Myocarditis is an inflammation of the heart muscle. The heart is essentially composed of three layers: the inner endocardium, the middle myocardium, and the outer pericardium. Within these muscle cells, the heart's excitation system is located, and the muscle cells contract to pump blood. Therefore, the inflammation can impair your heart's ability to pump blood and will produce rapid or irregular heartbeats, so-called arrhythmias. Stay tuned and let's learn more about the different symptoms. At the end, we'll give you tips on what you can do to prevent or get rid of myocarditis. Myocarditis is mainly caused by viral infections. Sometimes it can be caused by medications or be a part of a larger inflammatory illness. So let's dive in. What are the signs and symptoms of the disease? If you have myocarditis in its early stages, you may experience modest symptoms such as chest pain, fast or irregular heartbeats, or shortness of breath. Some persons with early-stage myocarditis have no symptoms at all. Depending on the source of the disease, the signs and symptoms of myocarditis differ. The following are common myocarditis signs and symptoms. Chest age, a rapid or irregular pulse, so-called arrhythmias. At rest or during exertion, you may experience shortness of breath, swelling of your legs, ankles and feet due to fluid buildup. Fatigue. You may experience other symptoms of viral infection, including a headache, body aches, joint discomfort, fever, a sore throat, and diarrhea. Beware, myocarditis symptoms can mimic those of a heart attack. Seek emergency medical attention if you are experiencing inexplicable chest discomfort and shortness of breath. If you've had an infection, keep an eye out for myocarditis symptoms and notify your doctor if they appear. If you are experiencing severe symptoms, go to the emergency room or dial 911. What are the causes of myocarditis? The cause of myocarditis is frequently unknown and hard to diagnose. There are numerous probable causes, but the likelihood of getting a myocarditis is extremely low. Myocarditis can be caused by a variety of factors, including viruses. Many viruses have been linked to myocarditis, including the viruses that cause the common cold, COVID-19, hepatitis B and C, parvovirus, which produces a moderate rash in children, and herpes simplex virus. Myocarditis can also be caused by gastrointestinal infections, mononucleosis, and German measles. It is also prevalent in patients infected with HIV, the virus that causes AIDS. Bacteria: Staphylococcus aureus, Streptococcus, the bacterium that causes diphtheria, and the tick-borne bacterium that causes Lyme disease are all bacteria that can cause myocarditis. Parasites: among these are parasites like Trypanosoma cruzi, the cause of Chagas disease, and Toxoplasma. Chagas disease is far more frequent in Central and South America than in the United States, but it can infect tourists and immigrants from that region. Fungi: yeast infections such as Candida, molds such as Aspergillus, and other fungi such as Histoplasma, which are frequently found in bird droppings, can occasionally cause myocarditis, especially in patients with compromised immune system. Myocarditis can also occur if you are exposed to medications or illegal medications that could result in an allergic or hazardous reaction. These include cancer treatments, antibiotics such as penicillin and sulfonamide pharmaceuticals, anti-seizure medications, and illegal narcotics such as cocaine. Either chemicals or radiation. Myocarditis can be caused by exposure to certain substances, such as carbon monoxide and radiation. Other rheumatologic illnesses: lupus erythematosus, Dr. House's favorite diagnosis, and weakness granulomatosis are examples of these. What are the complications? Myocarditis usually resolves without causing long-term problems. Severe myocarditis, on the other hand, can permanently damage your heart muscle, perhaps resulting in failure of the heart. Myocarditis, if left untreated, can cause muscular damage in your heart, preventing it from adequately pumping blood. Myocarditis-related heart failure may need the use of a ventricular assist device or a heart transplant in extreme situations. Stroke or heart attack. If the muscle in your heart is injured and unable to pump blood, The blood that gathers in your heart can form clots. A heart attack can occur if a clot blocks one of your heart arteries. A stroke can occur if a blood clot in your heart travels to an artery leading to your brain. Heartbeats that are too fast or too irregular, so-called arrhythmias. An irregular cardiac rhythm can be caused by damage to your heart muscle. Unexpected cardiac death. Certain severe arrhythmias can stop your heart from beating, sudden cardiac arrest. If not treated immediately, it is fatal. What can you do to prevent myocarditis? Myocarditis, depending on the cause, oftentimes has no specific treatment. However, adopting the following precautions to avoid infection may be beneficial. People who have a viral or flu-like sickness should be avoided until they have recovered. If you have symptoms of a viral infection, try not to expose others and don't overexert yourself. Maintain good hygiene. Hand washing on a regular basis can help prevent the spread of sickness. Avoid high-risk habits. Avoid using illegal drugs and practice safe sex to lower your risk of contracting an HIV-related cardiac infection. Reduce your tick exposure. Wear long-sleeved shirts and long pants to protect as much of your skin as possible if you spend time in tick-infested locations. Use DEET-containing tick and insect repellents. Get your vaccinations. Maintain current vaccinations, including those that protect against COVID-19, rubella, and influenza, infections that cause myocarditis. So that's it for now. Let us know your thoughts in the comment section below and see you in the next video.